Okay.
Okay.
Okay. So good morning, everyone, and thank you, Lavinia and Bogdan and Jean-Marie for setting up this very interesting web conference. I think we have a very exciting program, and I won't be long in my intro. Just saying that the topic is obviously extremely important, both in terms of science and in terms of public health. So I'm not exactly sure whether you can see slides that have been prepared for this intro, but I would assume that we can see it. The main message I would like to, there are a few issues that I'd like to address as an introduction. First of all, of course, the so-called dementias are highly prevalent. As we know, it is estimated by the WHO 3 years ago, was it, that dementia was estimated affecting like 47 million people worldwide, but we know that it's probably grossly underestimated, as for instance in Western countries such as Switzerland or France or Germany, probably half of the demented people are not receiving diagnosis, in fact, for various reasons. So the problem is a huge health concern, and it's absolutely worldwide, because we know that the least favored countries also begin to observe, because of the rising age of survival, the life expectancy is rising also in the least favored countries, and as people get older, they also begin to present with this sort of cognitive disorders that are associated with aging. Because in fact, I think that this is really the question of brain health across life and with aging, which is at stake, and not at all dementia. So we are talking about age-associated cognitive disease rather than dementias as such. Dementia being the ultimate stage of the long evolving disease, and as you know, we realize over the last decade that this is really what we should conceive as a scientific and medical framework. It's protracted, very slow evolving disease. So in one of these slides, first slide, the first slide intended to illustrate that there is a huge variety of the disease, which is not only focus on Alzheimer's disease per se, but really a large variety of different brain disease, including other so-called neurodegenerative disease, such as, for instance, synucleinopathy or Lewy body disease, for instance. The group of frontotemporal dementia and tauopathies and TDP-43 and other proteinopathies, but also vascular insult and chronic vascular insult affecting small vessels in the brain, and especially in the deep white matter part of the brain. And this microvascular leukoencephalopathy is really a big concern, because it is associated with Alzheimer's disease per se, and it is also probably an independent cause, an independent mechanisms causing cognitive disorders and ultimately dementia. So everybody in another slide, very well known, nothing really new here. It's the famous Jack and Cliff Jack et al. Diagram showing the evolution, the slow evolution of this disease. And again, this diagram conveys the idea of a very, very protracted time course of the evolution of the disease. The disease being defined in biological terms first, meaning that biological events, a variety of biological events would begin without any clinical manifestations, at least in the usual way we assess patients. So it's really silent mechanisms that are evolving by this time, and then slowly there would be an accumulation, cumulative phenomenon in brain, both in terms of proteinopathy propagating across the different brain regions, and also probably microvascular events multiplying in the white matter. So this is extremely important to understand that probably during like 10 years or probably even more, there are in the brain compensatory mechanisms that allow the brain, in fact, to cope with these progressive and the cumulative, the accumulation of these lesions. And again, the lesions are multiple, both proteinopathy, vascular insult, and also neuroinflammatory responses that aggravate, in fact, the situation and the pathogeny. So it would be extremely important to understand better the mechanisms of this compensation that, again, account for the very slow, the very protracted evolution of this chronic disease. If we could understand better the way the brain for certain period is able to compensate for these lesions, then I really think we could have very interesting approaches of new therapeutic strategies, if only we could understand how the brain can compensate and does compensate for the accumulation, the effect of the accumulation of these lesions. So as we know, there are also different factors for this disease, and some factors are modifiable factors, such as, let's say, in general, the cardiovascular risk factors that are very well known to be amenable and accessible to low-cost therapies and drugs and therapeutic schemes. And also there are, unfortunately, also non-modifiable cause or origins or risks for dementia, such as, for instance, the genetics of some genetic characteristics, especially ApoE4, but not only this one, also a combination of other polygenic influences apart from the very famous, well-known ApoE4. And non-modifiable also are, say, the past events. And among the past events, of course, are the traumas, both psychological and physical traumas. And it is now well documented that closed head injury represent an independent factor for a bad cognitive fate, in fact, in aging. So we should be aware, of course, of all these risk factors and to also how we should address the modifiable versus non-modifiable of factors. So an obvious question.
We will have to stop here because we are over time. I'm sorry for that.
Okay. My last word would be to address whether it is really interesting to want to study better this disease if there are no treatments. And the last slide was meant to illustrate that there is many different therapeutic trials going on, and so it's not the case that there is no hope for any treatment. On the contrary, and so it's also it's a good reason for getting forward in this very exciting field. And now I stop now, and I wish you a good symposium.
Thank you for your introduction. Very insightful about the disease and the perspective of it. And I thank you very, very much to have introduced to this symposium. Thank you.
You're welcome.